Good afternoon and welcome to GP Video Podcast by Nadia. Today was the last day of GP24 conference in Perth. Last day I spent at all the stalls that I missed seeing them during the last 2 days. So there was a big exhibition hall which had so many stalls from so many different companies, like pharmaceutical companies, like different medical recruitment agencies, different AI prescribing companies, and then career-wise, different stuff, health pathways, therapeutic guidelines, many stalls. So really had fun at all of those stalls, learned a lot of things, and I will be discussing with you a lot of stuff that I have studied and I have learned. But today, what I'm going to discuss with you quickly is a new thing that I have learned, which is a 45 years to 49 years old health assessment. So if you are between 45 years to 49 years, whichever gender, male or female, if you are going to your GP, you can ask for a health assessment. And what should that health assessment include? That I will tell you now. And you should make sure that your GP covers all these points. You can actually write down these points, and if, for example, they don't cover it, you can ask for them. For the points that are missed, and I will be doing it with I usually do it with my patients as well, but now I'm going to be very specific. So from 45 years to 49 years old, what are the things that we should be covering in our health assessments, in our overall health checkup? So first of all, we'll go for the biological stuff. Number one, if you are, of course, a female, menopausal symptoms. So 45 to 49 years age health assessment should include talking about menopausal symptoms, because you could very well be in perimenopause at that stage. Number two, cardiovascular risk assessment. So you should definitely ask, if you're a male or female, for cardiovascular risk assessment from your doctor. That will include calculating your blood pressure, your weight, and other cardiovascular risk factors. Number three is breast cancer risk. So for all the women, breast cancer risk assessment should be very necessary between 45 to 49 years age. Then cervical screening for all the women. So see, women have got more points to be discussing. Menopausal symptoms, because you could very well be in perimenopause. Breast cancer risk assessment, because after 45 we start doing mammograms, and then cervical screening test also is included in this age group. Then number four, which is a new thing, it's osteoporosis that we spoke about the other day, and fracture risk. Because osteoporosis risk factor assessment should be started from the perimenopausal age. In fact, should be even earlier than that, but then all the risk factors, and then discussing about all the preventative steps that need to be taken. For example, taking adequate vitamin D, taking adequate calcium, taking adequate proteins, doing the adequate and the actual nature of exercise, not smoking, not more than 2 standard drinks of alcohol a day. So discussing all these preventative steps that I have already covered in my previous osteoporosis prevention in perimenopause video. This should all be discussed. Okay, so not only for females, but for males as well. So, and then also about the, so yes, osteoporosis and fracture risk, not only for women. For women, it's of utmost importance, but for men as well. So menopausal symptoms, breast cancer and cervical screening for females only, while for males and females, cardiovascular risk assessment and osteoporosis and fracture risk assessment. Apart from the risk assessments, we would also be discussing the nutrition status or diet, exercise, weight, and sleep. These patterns should also be weight or BMI, body mass index, so weight, height, and both. And this is also included in cardiovascular risk assessment anyways. So again, I would repeat, in biological assessment for a 45 to 49 years old female, menopausal symptoms, cardiovascular risk assessment, breast cancer risk assessment, cervical screening test, osteoporosis and fracture risk, nutrition or diet, exercise, weight or BMI, weight, height, body mass index, and sleep. While for males, cardiovascular risk assessment, osteoporosis and fracture risk, nutrition, exercise, weight, height, BMI, and sleep. In psychological, for both females and males, the things to discuss are mood, cognition, and sexual intimacy. So these are the psychological factors that should be included. And in social, we will be doing domestic violence risk assessment for both male and females again, STI screening, sexually transmitted infectious diseases screening, and alcohol, like are we crossing the standard drinks of alcohol, and if there is any alcohol overuse issues. So these are the things that should be covered in a 45 to 49 years old health assessment. So if you are 45 to 49 years old and you're going to your GP, please ask them for this health assessment and also make a list of all these points and make sure none of these points are missed. See you next time.